Hi, folks. I'm Howard Lux,
And I'm Jeff Berg.
two orthopedists bringing you a lot of experience. Today, we're going to talk about hamstring injuries. Jeff, what do we know about hamstring injuries?
Well, most of the time they're muscle strains, and you got to differentiate those. People always come to me, sprains. Sprains are ligament injuries. Strains are muscle injuries. And they actually, if you have a pretty good sized hamstring strain, you've torn the muscle. They
Right.
bleed, you get stiffness, they hurt.
Right. Now, hamstring injuries can occur in different areas, right? They can occur in the muscle tendon junction, and up in the pelvis where the muscle inserts or the tendon inserts. Is one worse than the other?
Yeah, well, the muscle strains, they're the ones that we can usually heal without much concern. We worry about recurrence, and we can get into how you treat those. You get them up higher, and sometimes those need surgery. You pull that tendon off the bone, and some people can have a sense of weakness, have trouble with sports, and they sometimes have to be repaired surgically. Fortunately, they're much less common.
So the hamstring group is a large group of muscles in the back of your thigh. Common injuries. This is a common injury. Soccer players, sprinters, and people who take off fast, and you feel that pull in the back of your leg, and then you go down. If you do get a feeling of weakness, as Jeff just alluded to, it could mean that the tendon has been completely torn. There are many muscles involved, and if all of them are torn, you need to typically have them repaired. Have you done many of these, Jeff?
Yeah, no, they're rare. I haven't done many, but I have done them.
I have.
And it's been actually pretty gratifying. They're hard to recover from for the patient, but it makes a big difference for them. But fortunately, they're rare. I think most people, just to make it simple for everybody, that when you pull them off the bone, most of the pain is going to be right in your butt. But the more common hamstring is sort of in the middle of the back of your thigh. And that's where we mostly will see them.
Right. And I don't want to fix these. This is not a fun surgery to do. It is gratifying, but it's not a fun place to be.
No, it's not fun at all for the surgeon, and it's really not fun for the patient. The recovery is a little tough.
So the biggest problem with athletes and the biggest worry is recurrence. It's unpredictable who's going to recur and who isn't, but the recurrence rate is higher than we want it to be and certainly higher than you want it to be.
Yeah. So that's the discussion I always have with patients. They come in, they're swollen, they're sore, and there isn't a tremendous amount that I can do to help them. Perhaps they could take some medications to help with their discomfort or do simple things and rest it. But the real thing that I tell them is that risk of recurrence. And I kind of, basically my understanding on it is that when the muscle heals, it's shorter, it's tighter, and it's not as strong as it otherwise would be. So now you go out and run to first base full speed and you repop your hamstring. So my real emphasis for my patients is getting them into therapy to try to get better flexibility, better strength, and better endurance. So hopefully they don't have a re-injury.
Exactly. Just like the research and literature is starting to prove in the world of ACL tears and rehab, if you're not ready to go back, you shouldn't go back. You're going to re-injure yourself and you're going to start the clock all over again.
Yeah, I don't think the average person is like Usain Bolt, who wins a gold medal only a month after his hamstring strain. Most people, it's going to take a lot longer to get back to any significant level of athletics than that.
Absolutely. All right, folks. Take care. We'll see you.
All right.
Bye.